If you see me right now on live on Facebook, please guys let me know. Today, again, it's an important session. And I always say if you want to pass ADC exam, you must attend this mocks. And not just only this mocks, definitely. Also, you need to attend our private mocks too. And then all the sessions, guys, we do are equally important because I always say I never say anything which is not related to ADC exam. Once I start to talk about dentistry, you straight away understand that I'm talking about something very important related to your exam. Before guys I start, I would love to check on every one of you. And please guys, if you see that I'm live on Facebook, please guys let me know. Thank you very much. So how are you doing guys? How's every one of you? Let me also access my Facebook from the phone because it seems like the Facebook for more than a month, it does play a bad game. The phone because seems like the Facebook. Yes, I can see my voice back again here. Seems like yes, I'm live right now on the Facebook. Okay, guys. Hello, Dr. Nikita. How you going? And congratulations for getting 94% or 92%. Very high, about 90. That's a big one. So congratulations. And by the way, guys, I'm very proud of you. I'm very proud of every one of you. This patch seems like it's a unique patch. Batch 123 seems like it's really unique batch. I see there is lots of good starts happening right now. I see the candidates very smart. They are very motivated. And then they improved a lot very quickly. I don't know, guys, how come you scored above 90? I've seen lots of you guys scored about 90, above 80, and above 70. That was actually one of my happiness yesterday when I saw this result. Please, guys, keep doing the good thing. I don't know how did you score this. That's really great. Thank you, Dr. Nikita. Hi, Dr. Magda. How are you going? Hi, Dr. John. Thank you, Dr. Nikita. You know what, Dr. Nikita? There is one champion. Her name she is Dr. Nikita, and she passed, and I just shared her video today, and then I believe you have watched this video, I believe. So that's a good sign that you will pass too. Hi, Dr. Zah, how are you going? Dr. Musa, how are you going? Let me, guys, just do something here from my side. Just let me go home. Hopefully, everything happening, anything new happening is getting worse. I don't know why. Telegram, even they tried to do some update there, they made it very bad. Same with Facebook. Every time they do updates, they really make things worse, not better. Okay, let me check this. And then I think I need to press here for now. Ah. You see? Anyway, hi, Dr. Pavlo, how are you going? Dr. Musa, how are you going? Dr. Sayeda, how are you going? Dr. Kadam, how are you going? Dr. Omima, how are you going? Dr. Michael, Dr. Rainbow, Dr. Natalie, Dr. Harini, Dr. Ayushi, how are you going? Dr. Ayman, Dr. Shureya, Dr. Simran, Dr. Nikita again. No problem, Dr. Nikita. Dr. Shura, Dr. Ashnit, Dr. Manvi, Dr. Sepia, Dr. Amna, Dr. Hassan, Dr. Ayushi. Thank you. Yes, it's very motivating batch, yes. Dr. B, do you say that to every batch? No. You can actually ask the previous batch and the batch before. They will tell you Dr. B always will be very upset. Like yesterday in Academy, One of the candidates, actually, she passed this March. And then she met me in academy, like yesterday. And then uh, and then another candidate, she wanted to do a role play with me, both together. We are talking like group of people. And then she was saying, Dr. Adam, be angry. I said, but if I become angry, I will be very bad. She said, no, I know, like you will not be bad. I said, yes, but definitely, if the role play needs to be an angry patient, I will be angry patient. And then the another champion she passed from this march, she said yes. I remember him, he was very angry sometimes in his sessions because we didn't study. So definitely no. If you really do good job, I always say good job. If you're really not doing good job, you'll see me always say that's not a good job, I'm not happy, and I can be angry sometimes. But angry the way that I'm really worried about, the way that I'm worried about you. Dr. Press says, don't know when will I get 90%. You will get 90%, doctor, definitely. Okay, practice. Practice and reading. Guys, how did you reach 90%? That's a good question right now. Dr. Preya asks, don't know when I will get 90%. Guys, for everyone got 90%, can you please, in a comment, can you please tell us, how did you get 90%? That's even good. You know what? That should be a good one to every candidate here. Dr. Nekta says, I saw her video. Doctor, congratulations to her. And same and congratulations. And I wish you the same as well. Okay. Thank you, Dr. John, very much. Thank you very much. Dr. Kadam, okay. Yes, Dr. Harvin. Dr. Harvin says, hopefully we'll get better and better together. Yes, that's happening. Hi, Dr. Bido. How did you guys got 90%? Please, guys, answer this. Dr. Rainey, hi, Dr. Bido. Good evening. Can I please know if your lecture will be uploaded on the drive eventually? Yes. Dr. Kavitha, hi, Doctor. Your class lectures? Waiting for today. I'm always very happy. Look, the day for mock or mock discussion, you know what, guys? I love my mock and mock discussion for two reasons. Number one, I know that's the best help for all the candidates because most of these questions we discuss right now are the logic you need to know before you go to exam. And also because really I put good efforts in it. I spend day and night doing these questions, especially now we're doing lots of mock exams because I want to help you and I see this is improvement has happened in our group because the new system we follow right now in the academy, plus the efforts we put together. That's why I'm very happy with this. I feel very happy even when I do the mock exams, as you see right now. But I love your lecture. They are so deep and specific. I want to more of your lectures. It's very nice to hear you and gain knowledge as well. Dr. Navneet, thank you very much for this. You know how much I respect you and I respect all of my champions. Thank you very much. And that's why I do lectures every day. And that's why, guys, because I love you. Yesterday, because was mock, I did lecture for part two. Today, I'm doing lecture for part one. Tomorrow will be part two. Monday will be part one. Tuesday will be part one, part two. Wednesday will be part one. Thursday will be part two. Friday again will be either part one or part two, and then again part one. Every day I have in the morning, either I'm working outside, like working in academy, And then at night, I come, guys, do my lectures. And even after we finish these lectures, I still keep working. So definitely, guys, all my life revolving around you. Okay, now let's start now with the questions. Guys, pen and paper, guys. Ready, guys, pen and paper? Have you heard everyone has passed the exam before, told you, attend the lectures, everyone. There is no one has passed the exam and they share their experience. And no one of them, when I ask them for part one or part two, what is the most important thing? They always say, attend the lectures, write down every single word I say. Why these people say this? Because people, they have been in part one, they went through the exam, they have been in part two, they went through the exam, they know exactly what sort of information you need to know for the exams. They struggle before you. So please, guys, pen and paper. So this is number one. Number two, they actually set the mock exams. Attend all the mock exams, right? The big champions. Noah's God has answered why. Dr. Michael, no one, guys, has answered why they scored above 90. Very bad people. Maybe I didn't see it. Dr. Michael, Dr. Bido, I always look forward to your sessions. It makes reading easy and very motivating. Any signs of repair disappear? Any sign? Well, I was somewhere here. Any signs of okay, despair disappear after your sessions? You are great. Thank you very much, this doctor. You're really amazing. Yes, I am learning new things. Thank you very much, Dr. Priya. Guys, I'm looking. Hello, Dr. Bidu. Awesome lectures and awesome Bidu. Oh, Bidu. Look, I'm now working on medical emergencies because I know it's vast topic, lots of confusions. You know what? You will be the easiest topic ever. After we did antibiotics and after we did prosto, now I'm going through a new period classification. Now will be the medical emergencies. Okay. Oh, okay. That's the one. I was looking for this. How did you get 90%? Dr. Nikta answered. I believe we need reading skills equally as we need knowledge because in exam they play with keywords. So we should know how to understand the question correctly. Big heart you. So how did you understand the question, Dr. Nikita? That's my next question now. Sorry, guys. Look, my lecture is very important, but your suggestions and your advice to each others equally important to my lecture. Anyway, I'm here. I will be starting. I don't think anything you have anything more important than ADC in your life right now. I'm taking from my time for you. Today is just for you. I should have spent this time outside. Today is Saturday, which is day off, but I prefer to be here. I hope you have the same feelings as well, that you want to be here because you want to pass the exam. So let's, guys, hear, guys, more from you, from Dr. Nikita, how they scored. Hi. Hi, Dr. Pamisa, how are you going? I see need to talk to you, Dr. Pamisa. Didn't forget this. Because there are some points we need to discuss it together. Just listen, Dr. Ashneet. Okay, guys. Here, guys, is the thing. Dr. Ashneet. Just listen every word of Dr. Bidu. It is all with Dr. Bidu's guidance. Thank you. Okay, there's another answer. Trust, keep on track, lectures and notes. I love this too. Perfect. Pedopedia for antibiotics was great help. More pedopedias, please, if you can. Yes, I'm doing now for okay. I think now, guys, we got enough. Let me check this. I think now we got enough recommendations or suggestions from the candidates who has scored above 90. I think we have more here. Yes, you answered this one, Dr. Nekta. True. Reason for mock, attend reason for mock. attend every lectures, and read every line of notes. I'm very happy. Dr. B, do I have a question? What's the question? What do you eat for the amazing energy? It's not about food. I think it's more an I don't know, maybe I don't know. Not about food, not about food. Maybe there is a goal, because there is a goal. There's always a target and there's a goal I need to achieve. Okay, guys, let's start right now. I'm very motivated right now, guys, with everything happening here. And with your results, let's start. Now, Alan is a 50-year-old male. Male guys like a man, okay? Present with mild facial swelling. Okay. In my lectures and the pedopedia, if the word facial swelling has mentioned, so facial swelling plus one of systemic mild, let's say mild systemic feature. So how we call this condition, and if the reason is necrotic tooth. How we call this condition, guys? Let me check from here. Thank you very much. Spreading odontogenic infection. Now, because the word facial swelling, now we call it spreading. Right? Spreading. Good. If there is no facial swelling, how we call it? Localized. Very good. Now, if it's a mild facial swelling, so what could be the diagnosis of the word mild? So guys, what's diagnosis will be? Will be spreading odontogenic infection without severe feature, right? Very good. So now the diagnosis is spreading because it's facial swelling without severe feature because it's just a mild. Can you guys change this word for me? Can you change? Guys, I don't care about the answers. I care about this stuff. I don't care if the answer is A or B or C or D or E. I care about the information I give to you right now. Can you please, guys, change this word to me? No, I don't want to make it easy to you. I want to make you guys very smart. Change one word here. Let's play this game together. Change one word here, so the diagnosis will be shifted from spreading odontogenic infection without severe feature to spreading odontogenic infection with severe feature. Let's see right now. Did you get it? Okay, no. No. Okay, there are some of you did it very nice. I can see this. Let me just do this one. You know, when I ask you guys question, always is only one thing in my mind. Only one thing in my mind. Okay. I see now your answer. Okay. Guys, only I'm looking for the word significant. Significant. Once see the word significant, I'll be very happy. Severe, that's okay, Dr. Ramima, very close. Severe is very close. Severe, Dr. Anon, very close, which I'm happy. Severe, I'm happy. Significant, I love this word. Both correct, that's one. Thank you, Dr. Les. Severe is good, significant is good. But I like significant more. So when you say significant facial swelling, in this case, we'll be talking about spreading odontogenic infection with severe feature. But this one without severe feature. From where else I can tell, guys, there is another, in this lines, there is another feature. It does support, this is spreading odontogenic infection because facial swelling and the tooth is necrotic. I can see this from X-ray, there is radiolucency and stuff and whatever, right? Somehow with pulp test, we need to do it. There is another sign here as well. It does say it is just without severe feature. What is this? Temperature, guys, to make it easy to you. The temperature here is less than 38, means without severe feature. If it is above 38, if it's above 38 in this case, we can say it is with severe feature. Now, the question. So now, guys, the diagnosis in this case is spreading odontogenic infection without severe feature. Now, the question. Tooth. Which tooth is the most probable cause of the swelling based on clinical radiograph? The question asking about mainly the clinical radiograph. When you look at the clinical radiograph, you'll find the tooth most probably it has pulp exposure, pulp involvement, which it does result in pulp necrosis, and there is radiolucency around the root. Which those guys in X-ray you think? Look at this. This tooth, the pulp is still here, and all of this enamel on the top. This tooth, the pulp is here, and all of this looks like enamel on the top. So 1-1 seems okay. Not very good, but just. 2-1 seems okay. But the worst ever out of the 3 teeth shown the X-ray is tooth number 1-2. Why? Look at this pulp exposure. Look at this area. Look at the bone quality. There is something going there in this area. So most probably, tooth number from X-ray, you only need to know from X-ray. Tooth number 1-2 is the reason of the swelling and infection. The other options, not really correct. There's nothing there to explain about the other options. I just explained why this one. What is the next diagnostic test to confirm the most likely offending tooth? You already had an X-ray. We discussed in the lecture. We need to do 3 things. Guys, if you remember, guys, you know what? Forget about the answer. I don't know. I don't want the answer. I don't care about the answer. I care about this stuff. Everyone gonna write down the answer now. I'm telling you. If your presence now and attending the session now is to know the right answer only, I'm telling you, this is not the right way. Because when you go to exam, you will be stuck between 2-3 options. But if your idea, or you are here today, the main goal, you are here today because you really want to understand dentistry on the right way, so write down what we say right now, and that's the way you're gonna pass. So my question is, to remember, guys, what we explained about this part, we mentioned before, if we have a tooth like this, there are three things like this tooth. There are three things. Look at this. We need to check. Three structure. We need to check. Can please guys tell me what are the three structure? Again, I don't know the answer. Three structures we need to check. We mentioned this before. The first structure is the hard structure. Hard structure like crown. You know what, guys? If you don't do this, I will be very happy. Hard structure. What is the second, guys, we need? We need to check the pulp. That's the second. What is the third structure? We need to check periodontium. So now three things we need to check, right? The first one, the hard structure. The hard, like the crown, enamel and stuff, the roots, the bone around, maybe. The second one is the pulp. The third one is the periodontium. So now we need three things, right? So how we check the hard structure? X-ray. The hard structure we check by X-ray. Like the crown, where is the caries starting, how deep the caries, all the stuff like this one. How to check the pulp, the second structure? Vitality test or sensibility test. How to check the periodontium plus X-ray, definitely, because it's important, will be percussion. So three things we need to do: X-ray, vitality, percussion. These are the most important things we need to do when we have this type of condition. Is that, guys, clear? Yes. We did already X-ray. Perfect. What after X-ray? Sensibility test. Easy. OPG, not good. Why? Not always good, especially we already have done periapical X-ray. Much more important, periapical X-ray in these cases. CBCT is too much. CBCT can be the best X-ray ever. Like when they ask an exam, what is the best X-ray? CBCT. Needle biopsy, that's anything. Not now, we don't need it. Full blood count is anything. No needed in this case. So the answer, guys, was A alpha. Third question, what is the most likely diagnosis? One thing, guys, the right answer now. Thank you, Dr. Pereira. This is great. Thank you, Dr. Har Simran. Good answer. No problem, Dr. Pamisa. Thank you, Dr. Mima. That's the one, you're right. Thank you, Dr. Michael. Thank you, Dr. Iman, very much. Yes, vitality test. Yes, totally right. Okay, guys, we already answered this question. We mentioned the answer should be spreading odontogenic infection without severe feature, D delta. Someone may say, doctor, it's not localized. Yes, it's not localized. You're totally right. It's not. Someone may say, doctor, is spreading odontogenic infection. True. With severe feature, wrong. We said without severe feature. Someone might say, doctor, it's periapical abscess. It's not just periapical abscess. In Australia, we have, for infection, we have three terms. Three terms. Localized, like this one. Spreading without, like this one. Spreading with, like this one. That's it. So litis, it doesn't specify very much what is this. So the answer now, guys, is D delta. Learn the things on Australian ways. That's, guys, the way we write down in the clinics in Australia. We write down, if I'm going now to refer the patient to specialist for any reason or a hospital, I should write down either option A, like localized oncogenic infection, or option B, spread oncogenic with severe feature, or option D. But I don't write down cellulitis, I don't write periapical abscess. One of these, one of the three. Answer is D delta. So, however, cellulitis is correct, but not accurate, not the best. Question 4, guys. What do you think the right answer for question 4? Patient now has uncontrolled diabetes, or guys, what do you think of diabetes right now? Is it controlled or uncontrolled? If someone's HbA1c is 9%, is it controlled or uncontrolled? It is uncontrolled. When exactly will be controlled? Less than 7. Less than 7% will be controlled. What is the advantage of HbA1c with HbA1c? It does check the blood glucose level for 2 to 3 months. Guys, please, guys, write down this stuff again. I don't say anything for no reason. I always say the thing you need it for the exam. That's it. And also, you need it to be a good dentist as well. If you have heard Dr. Ahmed yesterday, who has passed part 1 and part 2. Guys, who guys has attended Dr. Ahmed's session yesterday? Dr. Ahmed, guys, who has passed part 1 and part 2 exam, like you passed yesterday. Did you guys? You remember, what did he say? He said, I became a better dentist now. And he's working in his country. And he said, I got more patients in my practice now. Only, guys, applying the things we mentioned here. You will get even more patients in your clinic. Good. What is the most appropriate management of the offending tooth in patients with diabetes? A. Immediate extraction and amoxicillin 2 gram 1 hour before extraction. That's called prophylactic. Please, guys, go back again to Pedopedia. In antibiotic, you will find patient with diabetes does not need for prophylactic antibiotic. So this is wrong answer. Option B, incision drainage. Perfect, very good, why not? Followed by extraction in a week. Wrong. Wrong. We should do the treatment immediately. That's wrong. Doctor, but the patient is poorly uncontrolled diabetic patient. We cannot do extraction today. No, wrong. Do extraction today. Option C, prescribe antibiotics. Perfect, why not? Because it's spreading odontogenic infection. And when it's spread odontogenic infection, we need to prescribe antibiotics. And the extraction, wrong. Thorough root canal treatment, debridement, perfect. Why not? Drainage through the canal, perfect. Amoxicillin 5 days, perfect. That's exactly what we need. If patient has spreading odontogenic infection without severe feature, RCT is one of the good treatment option because you get to drainage through the RCT and you're gonna address the cause and you're gonna save the tooth as long as the tooth can be saved. Plus, we need antibiotics for 5 days. Perfect. D delta is the best. C is wrong. So the answer, guys, is D delta. What is the most appropriate anesthetic technique to extract tooth number 31? Now, guys, we talk about 31. Do you think for tooth number 31, which is the bottom, do you think it's better to give nerve block or infiltration? Buccal infiltration, lingual infiltration, or nerve block? Dr. Mustafa says, it's my first lesson. D. Very good, Dr. Mustafa. Totally right. 3-point, hard structures, crown, bone, root. Very good. Pulp. Wow. That big heart to you, Dr. Harvin. Okay, guys. Now, in the lower teeth, like this way, let's say if we have a lower teeth like this, there's tooth number 31 and this 41. There is a nerve coming from here, a nerve coming from here. This nerve is incisive nerve, and this nerve is incisive nerve. This coming from the left-hand side. This coming from the right-hand side. Sometimes, when you give a nerve block, that's a nerve, okay? This mental nerve, which is a branch of mandibular nerve, the big one, the inferior alveolar nerve, right? So now mandibular will be inferior alveolar, and then inferior alveolar will be given mental will give incisive. So when you give any of this nerve block, this nerve only branches will be anesthetized. But sometimes for bad luck, what happens with lots of patients, you will find there's something called anastomosis. What does it mean, anastomosis, guys? Means there is one sneaky branch, like very sneaky, like a snake, comes from this side, right? And then it does say, look, you know what? Do you think I'm just only going to supply this tooth only? No, I will be supplying you two, 3-1. We are one family. Let's supply this tooth and that tooth. So if you give nerve block for the main nerve trunk here, you will actually anesthetize the fibers coming from the left-hand side nerve, but because the sneaky nerve, right, very annoying, will come from the right-hand side and then give a supply hit too. So in this case, anesthetic will not work. The patient will still feel pain because this nerve, not the nerve block. So what is the best way? The best way is give infiltration. When you give infiltration, any nerve coming from the right-hand side or the left-hand side will be anesthetized. So guys, the right answer right now is infiltration. Clear now, guys? Is that clear, guys, to everyone? That's the one. Buccal and lingual infiltration with lignocaine. Easy, right? Not hard. Now, you see, guys, easy concepts like this. Once you know them, you will find them in exam. Just take the right answer related to this question. That's it. Next scenario. Guys, what think, guys, the right answer of this question? At this stage, what is the most appropriate immediate clinical action? You cannot answer this question unless you get what? Look, guys, information gathering cluster or diagnose and management cluster or clinical treatment and evaluation cluster. It is too hard to get the right answer unless you get the initial diagnosis first. So I'm looking at the question for one reason only, to check about the patient's concern and the initial diagnosis. So guys, look at the photo, plus we look at the history. What do you think is the initial diagnosis? Let's think about it together. A 9-year-old female presents for routine dental visits for a skin and clean after not attended dental care for approximately 7 years. Patient is asymptomatic, has no signs or symptoms. She's okay, no complaint. Her medical history includes type 2 diabetes. Okay. Recently tested and found to be uncontrolled. Okay, whatever. Hypertension, whatever. Social history reveals cigarette smoking. Oh, there's one big risk factor. Now, there is a lesion on lateral. Look, guys, at this word. Be careful with this word. Lateral surface on the tongue. A lesion on the lateral surface of the tongue, plus it's white in color like careful, plus there is a smoking risk, and the alcohol, plus what? Asymptomatic, not painful, plus you cannot remove it. And the word persistent existing. The word persistent. So guys, all of this, how we call them? How we call all of these guys together? If it's from two words, it has a color in it. It has two words, it has a color in it. Red flags. Thank you very much, Dr. Vipa. Now, guys, we have at least 4 to 5 red flags, minimum 4 to 5. Now, if you have these red flags, what you need to do? Thank you, Dr. Nekti. If you have, guys, these red flags, what you need to do? Be bravo. We need to refer. Please, guys, like, you know what? For example, I love this. Like Dr. Achal, I definitely like your answer, which is predisposing factors. But please, for ADC, we need to learn the exact language. We need to understand why is this, because that's what they're going to use in the exam. For example, predisposing factor is good, but the red flags is the correct one. So always need to stick the same language. Okay? This guys based to everyone. Red flags. We have now red flags. If you have red flags, what you need to do? Yes, Dr. Achel. Very good, Dr. Achel. You said refer. I'm happy with this. Refer. To oral and the maxillofacial surgeon. Why? For assessment and examination, most properly, will be biopsy. Option A, prescribed topical corticosteroid. It's not a condition for topical corticosteroid. My initial diagnosis is suspicious ulcer, suspicious lesion, could be cancer. So A, it's not correct. C, refer to oral medicine specialist for punch biopsy. No, we don't like punch biopsy, guys. Look, in exam, if you see the word punch biopsy, don't choose it because we don't like it in Australia. Advice immediate smoking cessation. Not really. We have a big issue to control first. Control this issue and then advise. You can do it today, but this is the most important. B is more dangerous. We need it. B bravo. We need it. C it comes after B. B first, D second. Refer the patient to their GP to optimize glycemic control. Again, that's secondary. But this is the most significant and the most important. So the answer, guys, B, bravo. Is that, guys, clear to everyone? Can I get, because I know this question a bit tricky. Do you know, guys, what is, okay, I tell you something, okay? From this scenario, there is one word. I only, guys, need one word. Listen to me carefully. I now speak the same language like exam. I'm speaking with the same language like the exam. There is only one single word. In this scenario, is the most important word that actually, after I looked at the photo, only one single word made me, plus the photo, made me to decide to refer this patient to specialist. Which is this word? You see, no wonder, Dr. Nikita, you scored above 90. Yes, the word is persistent. Thank you, Dr. Nikita. Yes, persistent. What does it mean, the word, guys, persistent? Thank you, Dr. Sayeda. What does it mean, guys, word persistent? It is more than 2 weeks. Now, if the lesion has stayed or persist for more, look, guys, persist, present, presented, stayed for more than 2 weeks, it is the biggest, it's a biggest red flag. That's you need to be refer the patient to specialist. Thank you very much, guys. Very smart. The word persistent, this word. Next question. Which of the following is least likely to explain the nature of this lesion at this stage? Which of the following is the least likely to explain the nature of the lesion? Lesion is suspicious. It can be cancer. Now think about it. It can be cancer. Which one of these can be the right answer? I'm very, guys, proud of you. I see your answer, every one of you say more than 2 weeks. Not healing for more than 2 weeks. Thank you, Dr. Achia. That's a good one. Perfect. Since a long time. Perfect. Good answer as well. Dr. Musa mentions location. Location is important, but I said plus the photograph. So I already on the photo, I have seen the location. On the photo, I have seen the color, right? Plus this, plus location and the color. What, and size as well. In the photo, I've seen the size. It was 2 weeks. What is the answer? I see, guys, you provide different answers here. I see Dr. Karan mentioned C Charlie. And then Dr. Sayeda D Delta, Dr. Nikita D Delta, Dr. Musa D Delta. Dr. Snehal said Afas, D Delta, D Delta. Option is D because no pain. I like this, Dr. Musa. Now, which of the following is least likely to explain the nature of this lesion at this stage? Answer, guys, D Delta, Afas ulcer. Why? Because Afas ulcer with this size, with a small size, right? It should be sore, painful. But this patient not sore. This patient is symptomatic. So small aphthous ulcer, like this, it should be sore. It's not sore. Patient said no sore. That's why, guys, the answer D delta. Some inflammatory can be not sore, by the way. Not every inflammatory is sore. Malignancy, asymptomatic, exactly as mentioned in the scenario. Infectious can be asymptomatic, but ulcers should be symptomatic, should be painful. So answer, guys, D delta. Clear, guys? Can I keep going? Is that clear, guys, to everyone? I know it's a little bit tricky question. Thank you, Dr. Atchel. Dr. Atchel mentioned clear. I'm very happy. How is the mock so far, guys? How is the mock? Is it hard? Is it challenging? Is it easy? Do you enjoy it? What do you think? Question 3. Interesting. I'm very happy, Dr. Atchel, to hear this. Dr. Bidu, LA questions? Which one LA question? Did I miss any? Did I? No, still 8. Okay. While completing your clinical notes, I'm now in the clinic. I'm writing down my notes. Now I consider whether any action performed now would meaningfully contribute to identifying and managing the condition without delaying definitive management. Which option is most appropriate? I'm thinking while I'm writing down my notes, which action I can do right now. It may help me to contribute, like to be helpful, to identify and manage the condition. Something to identify the condition. Which one? Most probably it's a cancer. It's a cancer. Which one of these? It can be related to cancer. Which one of these can be a feature of cancer? A, palpation of cervical lymph nodes. Yes, it can be a feature of cancer. I may need to do it today. Initiating measures to control diabetes. No, it's not. Diabetes, it's not my job, by the way. Diabetes is a GP job. And then this is not my main. It's not. Learn, guys, something. When you manage a patient, we need to give priority, prioritize things. I say this is my priority right now. That's what I need to do today. That's the most important thing for me. So cancer is the most important thing, not diabetes. A is correct. B is not. Soothing adjacent sharp line angle. Smoothing. That's okay. But it will not identify the condition. The condition is very suspicious. Even the ulcer doesn't look like even a traumatic ulcer. It doesn't look like traumatic ulcer. It's not. Not even sore. Replacement of existing amalgam. Anything secondary. Just secondary. Assessing the patient's stress level. That's anything secondary. That is the most important thing. Guys, is that guys clear? Can I keep going? B is secondary, C is secondary, D is secondary, E is secondary, A is the most important. That is related to cancer. The cancer may spread over everywhere. The reason for LA, because that's a gold standard. That's a gold standard. LA, guys, gold standard. The patient asks, why observation for a short period is not sufficient? Given, look, guys, we're talking about observation. For like, sometimes you know what? The patient tells you this one. Doctor, I'm very busy. What if you can just smooth out a round of the sharp edges and then I will be coming to you after 2 weeks, 3 weeks to check the progress. So now the question, why a short period? Observation for a short period not sufficient. Given the absence of pain or functional limitation, patient maybe even not able even to move the tongue. Which factor most strongly justifies escalation rather than short-term review? Like what things has made you to think, no, I cannot just follow up for short period without referring to specialist. I cannot do this. I really need to refer you to specialist. So which factor have made you to think this way? That I should refer you to specialist. Which factor, you guys? We already explained this one. Persistence, E-echo. Persistence is the most important. Doctor, but asymptomatic is very important. You know what? There are some ulcers and some lesions, they are not asymptomatic and still inflammatory in odor. That's okay. Uncontrolled diabetes, secondary, not important today that much as cancer. Cancer is the most important. Smoking history. There are lots of people, they are smoking and then they have ulcer. It only lasts for 1 week. And they will tell them, that's okay. I can see you after another 2 weeks. That's fine. So not smoking. Lateral tongue. There are some patients, they have lesions on the lateral tongue. And then when you look at it, we know it's more into sharp, it's more into traumatic because of sharp edges, how the photo present to us, how the signs, symptoms, how all the information findings we found, and they will tell the patient to come after 2 weeks. But this case, because it's already 2 weeks has gone, we cannot ask the patient to stay another 2 weeks. That is like, we have lots of red flags in this case. Answer is E. Guys, what do you think the answer to this question? Look, guys, I'm sure you have read TG. I'm sure you have read lots of good books. Lots. But the problem is in the books, you will not find these answers. You will not find this type of information or critical thinking, clinical judgment. How in the clinic should be smart in the clinic. That's the way that's ADC looking for. ADC, ADC, they don't, ADC don't look for just a dentist. They look for smart dentist who can apply the written information from books to the patient, not just only to read them. It's not. So guys, what do you think is the right answer here? The question asked about may address concurrent risk. May address concurrent risk. What does it mean, the word concurrent? Look at this, while ensuring the primary concern. So now, guys, what does it mean, the word concurrent? Before the patient leaves. Now the patient going to leave. You consider action that may address concurrent risk immediately. Another risk Secondary risk. Now, some people says A alpha. A alpha is incorrect for two reasons. One, for the reason the word quit. Guys, in Australia, when you try to talk about alcohol, we don't say quit alcohol. We say reduce alcohol. You see, guys, that's what I'm telling you. That's what you need to learn to pass the exam. These are small tricks, guys. I learned for 17 years, teaching for ADC. You can learn it in few weeks only. We don't say quit alcohol. We say reduce alcohol. But we can say quit smoking. So the option A is wrong because the word quit. Source food data advice. It is totally irrelevant. Totally irrelevant. Refer to GB for glycemic optimization. Correct. That's a secondary. That's a concurrent risk in this case. Behavior reassurance regard symptoms. Patient even doesn't have anything to do with it. And that's not a risk. The patient even not aware about it. Deferral of all additional advice. That is wrong. Totally wrong. Answer is C, Charlie. Next question. A 58-year-old woman from Brisbane attends with worsening pain and swelling associated with tooth number 36 for 2 days. Okay. Buccal fascia swelling. Tenderness. There's a charge. Again, infection again. No trismus. Infection. There is any swelling of the face? Yeah, buccal fascia swelling. And no neck swelling, no trismus. Same diagnosis like the first case. Same diagnosis. Which diagnosis, guys, most appropriate accounts for the current presentation? Do you know in the exam, maybe ADC, they will give you question twice, the scenario twice, or maybe 3-4 scenarios to discuss only on the same thing? So guys, what's the right answer? A, localized? No, it's not localized. Is it spreading? Yes, it's spreading. The answer is B, bravo, it's spreading. Spreading, odontogenic infection without severe feature. What about, doctor, the word worsening? That's okay. That's a pain worsening, but not the infection itself is worsening. So guys, the answer is the same things we explained in the first scenario. B, bravo. Pulp necrosis, we mentioned this. Pulp necrosis, for this case, not an answer. The answer can be one of three: localized or spreading, and the spreading can be with or without severe feature. That's it. Given extraction can be complete today, which antimicrobial approach is most appropriate to her condition? Yes. See, Charlie. Same things we mentioned in the first scenario, right? The immediate things, the most appropriate for her condition, immediate extraction followed by, okay, oral cefalexin. Why? Because the patient has allergies. Why not? I see people answer E-echo. Endocarditis prophylaxis is mandatory. Guys, do you think, guys, the patient has any high-risk cardiac condition? Dr. Kiran as well mentioned answer E-echo. Why is that confusion E-echo as well? Do we have any serious high-risk heart condition here that we need to prescribe antibiotic for? Because mitral valve prolapse, no. We don't prescribe prophylactic antibiotic for mitral valve prolapse. Please, guys, look at Pedopedia. Pedopedia has all the good information about this part. Easy written information. C, cephalexin, because patient has allergies. What sort of allergies did I know? It was mild allergies here. But there is no clindamycin as well. Okay, there's immediate extraction with clindamycin for allergies. I think there is keyword, guys, for allergies. Do you know, guys, what's the keyword for allergies? It is mild, because cephalexin will be mild, for mild allergies, and clindamycin for severe allergies. There is a keyword here, guys. It does guide us. It does guide us for mild allergies rather than severe allergies. Thank you, Dr. Amal. Dr. Amal mentioned rash. Thank you very much. The word previous rash means it's a mild allergies. Can you guys, you know what? I'm sure. Okay, I will show you guys. Give me 1 second. Give me 1 second because I remember right now something. I tell you something. Look, because I still work it out. Okay, I haven't finished it yet, guys. I haven't finished it yet. This look, guys. But not yet because I just now I remember about allergies. Now we've been talking. Look at this. You know, guys, how many days I'm in this only in this file? Do you know how many days? 3 days now, only in one file. Guys, can you see this right now? I'm not guys quite sure if you can see this or not. No, it seems like you cannot. You see, someone said airway obstruction, right? Okay. This guy's allergic reaction and anaphylaxis. Everything about anaphylaxis will find it here. In exam, you're gonna get question about anaphylaxis for penicillins, anaphylaxis for latex, anaphylaxis for NSAIDs, for Rabadam, for chlorhexidine, and which one can be the reason in this case? How do you know? How to identify? I make God things very easy to you. We still guys work on it. Look, airway, for example. There is a swelling on the face. Breathe in. How to remember them? That's the way, guys, to remember them. The features. How do you know it's mild or moderate or severe? The actions, what you need, the management, how to manage every condition. Like here, you need to remove the allergen. If possible, call 000. Oxygen first, then adrenaline. By the way, there is a big issue between these two information. Which one first? To call 000 or to give adrenaline. I know everyone now gonna be guys a big argument right now. Do you need to do adrenaline first in anaphylaxis shock or cold triple zero? TG going with cold triple zero. But the guidelines in Australia is to give adrenaline intramuscular first. If you ask my opinion, look guys, this guy's the dosage. Never forget it. If you ask my opinion, I would say this should be the third step to give adrenaline first and then cold triple zero because that's gonna be quicker. Like the action will be done quickly. However, in TG, it doesn't really specify very much to be cold triple zero, but in the diagram, they book cold triple zero first. If you ask my opinion, based on, guys, because TG taken, guys, look, TG actually takes the information either from ASCIA or from A ANZ COR, right? They take the information from them. These are the sources they mentioned. It should be adrenaline first, and does make sense. Because if I not say anaphylactic shock, I will give an adrenaline a second to save the patient while I'm on triple zero. But, guys, which one, guys, do you think first, guys? Triple zero first? Or to give injection first? I love these points. And believe me, guys, these are the points of exam. In TG, it doesn't specify, but in order they put triple zero first. Anyway, I feel guys very happy when I finish these notes. How do you feel, guys, about this? Guys, please, guys, everything I made it inside the box like this. Look, guys, like for example, I'm telling you now, okay? Any small things I made inside small box like this, or 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 like the yellow one, like this, or like this. These are the most important things you must read, because every one of these can be easily a question exam. That's why I made it separately in a small boxes by itself. Now, the right answer, C, Charlie. Guys, what was, guys, the right answer to this question? Thank you, Dr. Nandini. Thank you, Dr. Guys, Nandini says, cannot thank you enough. Thank you, Dr. Nandini. It's my pleasure, definitely. Sometimes, guys, I just disappear only because I'm working on this stuff, either mock or either notes. Thank you, Dr. Shipa, very much. This PDF will be getting, yes, will be given to us, given to you guys on the Google Drive, yes. On the private Google Drive. We need more pedopedias, yes. Okay, guys, right answer C. Next question. Based on her medical history, Which statement regarding prophylactic antibiotics is more appropriate for future routine data care? Based on her medical history, which statement regarding prophylactic antibiotics is most appropriate for future routine data care? The answer, guys, C, Charlie. Why? Neither infective endocarditis, because again, the condition just mitral valve prolapse. No routine surgical prophylaxis. Why? We have no one single condition for surgical prophylaxis. Please, guys, I need you to go through Pedopedia again if you answer this question wrong. Question 4. Following successful extraction and drainage today, which additional advice is most appropriate? It's an infection case. It's an infection case. The answer, guys, is you totally right, Dr. Iman. Yes, mitral valve prolapse, no endocarditis prophylaxis required. Very good. The right answer, guys, is B, bravo. Return urgently if swelling increases or swelling or swallowing, breathing difficult develops. Again, guys, you will find this in Pedopedia. Next question, please, guys. Well, I think, guys, next question then. Your answer is D delta. How? D delta, tell me. See, Charlie, guys. Which newly developed feature would most strongly change management? Yes. Community treatment, guys. What does it mean, community treatment? It means new clinic to urgent hospital. What gonna happen in ability to close the mouth with increased limitation of opening? If you attend Tuesday sessions as well, you'll be able to answer all those questions nice. Tuesday session, guys, very important. That's a critical thinking sessions. That's how you learn how to answer those questions. Next question, please, guys. What do you think the answer to this question? I give you 1 minute to read the scenario. So what do you think, guys, the right answer for this question? A alpha. I see, guys, some of you mentioned A alpha, which is correct answer. Primary hepatic gingival stomatitis. How do we know? Look, guys, at the photo. Wow, very red. Ulcers all around. Ulcer. Look at this. It's all the other side of my mouth. And the patient, about 9-year-old child. I don't think a 9-year-old can get necrotized gingivitis. That's too much. And then all the signs, symptoms move toward primary hepatic gingival stomatitis. What's, guys, next question then? The other next question. Answer, guys, D delta. Arrange immediate scale and clean to reduce gingival inflammation. The question asks about except A can be good, B can be good, C can be good. But if you do D, that will spread the infection around. We don't spread infection today. Guys, can you please, guys, tell me how the primary hepatic gingival stomatitis virus spread over? How does it spread, guys, this type of virus? Very good. Droplets. Saliva. I'm very happy with this. Droplet on saliva. Totally true. So all of the following, guys, form part of appropriate management except this one. Nope. We cannot do scale and clean. Question 3. What's, guys, answer question 3? See, Charlie, antibiotics are not routinely indicated unless there is clear secondary bacterial infection. Yes, we don't do this. Question 4. The father asks how much fluid Ethan should aim to drink. How much fluid Ethan should aim to drink over 24 hours. Which advice is most appropriate? How much fluid, guys? See, Charlie, 1.1 to 1.3 liters to the daily fluid intake over a small frequent amount. See, Charlie. Next question. Which additional feature would most strongly support considering early antiviral therapy? Like, you keep thinking, should I give them antivirus? I shouldn't give them antivirus. So what could be the reason for this? Why not D? D is wrong because say regardless of tolerance. Like if they cannot even tolerate, you just keep pushing them for 2 liters, and 2 liters is too much for a child, by the way. 9-year-old child's it's too much. Even one liter even can be 1 to 1 to 2 liters to until 2 liters max. That can be for adult, but that's even child. Guys, what guys the right answer now? Question 3, guys. What's the right answer? The father asks whether antibiotic already started elsewhere should be continued. Which response is the most appropriate? C, Charlie. Antibiotics are not routinely indicated unless there is a clear secondary bacterial infection. Guys, that was guys question 3. That is for the one. Guys, you ask about question 3, okay? If you ask back again about question 3. Question 5, guys, what is the right answer? A alpha. The right answer is A alpha. Symptoms begin within the last 48 72 hours with severe pain and poor drinking. A alpha alone. Next scenario should be easy scenario. Okay, guys, this scenario should be easy scenario. Easy peasy. Guys, how easy is perio now, guys, to you, for you? How easy, guys, perio for you right now? Very easy, Dr. Kadam, right? Thank you very much. Now, I need only, let's play this game together. I need only one word, 3 words, 3 continuous words here from this scenario to decide on stage 4. And I want one only information given here to decide on grade C. The answer, guys, is stage 4, grade C. Dr. Sayeda said very easy. I'm very happy. Dr. Leah says much easier than before. I'm very happy. Answer, guys, E echo. Give me only one word why it is stage 4. One thing only. Give me one thing only. Very easy, Ta. Okay, thank you. I'm telling you right now, I don't care about the right answer. I only care about the concepts. Concepts will be helping you in the exam, will be helping you in your clinic to be the best dentist ever. More than 5 teeth missing. Where about this information in this case? Either I start to sleep right now, Dr. Herini. Either I start to sleep right now, Dr. Herini, or I start to feel tired, or you are the one sleeping right now, or maybe you're reading different scenario. Guys, any guys information mention the scenario that the patient has 5 teeth missing? Completely upper. Because completely upper denture. Like, I don't know if that was for peri or not. I'm not sure. Honestly, I'm not sure. Is upper denture he born with it or not? If this is what you meant. In the scenario, guys, I see most of you guys doing great. Yes. In the scenario, great. No. Guys, everyone has answered. Grade 3 mobility. That's a one. Grade 3 mobility. That's a reason why we ended up with stage 4. Because if you're telling me the pocket depth 5 millimeter, I tell you 5 millimeter, that's okay. That can be any stage, but not stage 4. And the reason why we decided in grade C, because the patient, only one thing, I only said one thing. His patient is a smoker and they smoke 10 cigarettes per day. How did I know 10 cigarettes per day? The word half standard pack. Half standard pack means 10 cigarettes per day. The answer is equal. Next question. Cross to most properly. That's it, guys. How did you get wrong answers? If you look at this photo, what is the clinical condition the upper jaw is having? When you are looking at this photo, what is the dental clinical condition that the bone of the upper jaw is having? Guys, I need someone answer me, please, just to keep going. Thank you. Flappy tissue. Flappy tissue. Why this flappy tissue has happened? Combination syndrome. What does it mean, combination syndrome? There are natural teeth in the lower jaw. Does what? Traumatize the edentulous anterior segment of the upper jaw. So now there is hard teeth traumatize the bone. That's why the bone will be in this area, eating away 10 times faster than normal. That's why the anterior portion, anterior segment of the upper denture will lose weight and become slimmer. The bone will be slimmer. And because the bone will be slimmer, what can happen to the dress? The t-shirt, the business shirt, what can happen will be loose. So now mucosa will be loose. So what's the name of this condition? Right? Loose tissue, flappy ridge. Clear now, guys? Yes. So now if you have loose tissues and the bone underneath it is smaller, in this case, which do we really need to put too much pressure, compressive impression and pressure on this area? No. Why? Because later on the bone will be resorbed more. If you put too much compression or pressure on the impression, it can be too much forces. We need to reduce the forces. We need to be zero forces every time the patient bites on it, hitting. When the lower teeth hit this area, it should be zero forces. So which impression would give me zero forces? This impression. Why? Not actually zero, but will be the minimal. Why? Because we're gonna do it in 2 steps, modified technique. And we're gonna use live body polyvinyl siloxane to paint this area. without pressure. So polyvinyl, the live body, when we put it in the jaw to record this area, will not be any pressure. We do normally with a brush. We get a brush and then we can just only paint it by our finger or brush in this area because we need to have zero pressure or minimum pressure here. That's guys right answer. Anyway, we're gonna guys discuss this in details. And even guys, there is a pedopedia for it. And be delicious. And there is all the cakes as well for them. Guys, what do you think is the classification in this case? Very good. Bounded and the saddle. Bounded and the saddle. So because this is bounded, so we call it class 3. And any other space, we count it as one modification. So class 3, modification 1. See, Charlie, easy. We already discussed this before. See, guys, I'm very proud of you because whatever we discussed in the past is easy for you right now. You can answer it correct. I'm very happy. It means like you really study hard. Tricky, tricky. You remember, guys, how was this question tricky in the last mock? Let's see if you got the right idea now or not. Guys, what is the rule here? Forget about the answer. Every one of you should write down the rule and regulation this part. It's one sentence. 4 words. Actually, more than 4 words. No, they, have, you. One. Okay, about maximum 8, 7 to 10 words. Question 4 has confused me. Dr. Kadam, do you remember? We discussed the same. It's straightforward, very straightforward. The same concept last mock. If you write down, if every one of you guys gonna write down the regulation in this part, it's just one sentence. You wanna never ever forget again. The one, Dr. Again, no wonder why Dr. Nectar scored the highest. The one who used sharps is responsible. Very good, I'm happy. The dentist is primarily responsible for. But this is not the regulation. Look, in this scenario, right? In this scenario, dentist is primary responsible. In this scenario, but I'm talking about again, guys, I'm not teaching you only the right answer. I'm teaching you regulations. So, guys, Dr. Nikita has answered the regulations. Thank you, Dr. Nikita, very much. Dr. Nikita, guys, said the one who uses sharps is responsible. Perfect. I like this. Dr. Ayushi, look at this. The one who uses the sharps, they're responsible for the sharps. Very good, regardless of this person. That's, guys, I need you to learn, not the answers. That's why everyone tells me, doctor, or asks me, doctor, why did I fail the exam? I always say this is the first instance. Do you have your own justification, your own critical thinking? If that correct, means like you should pass the exam. Definitely, there can be a little bit of bad luck, and maybe sometimes it can be they couldn't sleep in same night. Maybe there are lots of other factors. But this is the most important factor. That's why, guys, I'm teaching you this stuff. Dr. Leas, the health practitioner who uses sharp instrument is responsible for it. Perfect. That's what I wanted. Thank you, Dr. Joanna. That's a one. Thank you, Dr. Snehal. Thank you, guys. That's a one. Now, I'm sure if you're going to get any question like this part, no one will answer this question wrong anymore. Regardless, How hard is the question or how tricky is the question? Answer, guys. C. Charlie, dentist. Next question. Question 5. You have constructed, guys, what think, guys, answer question 5? I feel, guys, okay. Tomorrow mock. No, tomorrow no mock. Tomorrow is part 2. Monday is, guys, everyone, guys, who has texted me, please, guys, everyone has texted me to join the course. Please, guys, text the academy because I'm trying to do my best to text you back. So please, guys, text the academy if you have texted me to join the course, because this Monday, guys, we'll have our session. Tuesday, we'll have another session as well. Monday and Tuesday, guys, our sessions, okay? By the way, guys, would you like to have mock next week? I will be announcing this after this mock, okay, guys? If we have enough candidates, they are available. If we have available candidates can be enough to do the mock the way that we believe no one gonna miss it. So guys, we can do mock next week as well. I know it's crazy, but as long as it does help you, I'm happy with it. So guys, what's the answer, guys, this question? Answer, guys, A alpha. The impression was distorted. You know what? We can discuss this in details, guys, when we start with Prost, but just to make it easy to you for this part, you know when you take an impression, and the impression in this case, and then you keep the impression dry, for example, for a few days, what's gonna happen? So the impression will be changed, will be smaller in size. The cast, when you make a cast out of this impression, the cast will be smaller in size. In this case, when you put the teeth on the cast, it will fit nicely. Why? Because the cast now is smaller than the teeth. The teeth on the cast is smaller, right? Than the natural teeth. And then if you're gonna fit the same crown, the same stuff on the natural teeth will not fit. Why? Because the natural teeth is now bigger. So the teeth will fit nicely on the denture, on the cast, but it will not fit nicely on the original teeth because now a bigger size. So that's, guys, a part of distortion of impression. Okay, guys, almost now we have 2 hours on Saturday night. So guys, I'm very proud of you. You are the real champions. The champions, they didn't win, they didn't go for dinner. The champions, they really attended the session, taking the right notes. They do the right things. One day I will see you guys successful, especially this batch. Ask, you know what, guys, you will find, because I know some of you actually took the last course for this September, because you know, guys, we sometimes allow you to attend two courses, right? Ask the champions, they did the course last time, and they tell them about the previous batch. Was amazing, the previous batch, amazing. I love them very much, and they're very special to me. But this batch, ask them, they may say this batch somehow it's a little bit better than the previous batch, especially at the start. At the middle, the other batch was from the middle. They've been fantastic from the middle and toward the end. But you guys from the start, amazing. You guys don't amazing. That's what, guys, I'm very happy. I'm very proud of you. Thank you very much, you guys. If I will announce shortly after I finish right now, I will be announcing for the mock on our Facebook group, guys. If you're really interested, let me know. Yes. If you don't interested, don't comment. So we'll not do it this week. We can do it in any other week. Okay. Thank you very much, you guys. My pleasure to have all of you here today. I was very happy. Thank you very much, guys. The answer, guys, A alpha, by the way. Thank you very much, you guys. Have a great night, every one of you. You really guys doing great. Patch 1, 2, 3, guys, you're really doing great. Thank you very much. Have a great night, everyone of you. Please, guys, be delicious. Sorry, pedia. Very important, please, guys, read them carefully and listen to all my recordings. I'm going now, guys, through your questions. If I have any question, I will answer it right now. I'm going now, guys, with all questions. How was the mock, guys? Did you like it? Yes, Doctor. Dr. Ayushi, can you explain inlay question again? Dr. Bido, scenario 1, question 5, please. Okay, so it's all about anesthetic. So in this case, we like infiltration because of anastomosis, to avoid the anastomosis, which is the nerve when does cross from the right hand side to left hand side. Because it doesn't mean 3-1 is left hand side tooth. It means only the innervation will be coming from the left hand side only. The innervation can be coming from the right hand side too. That's why we call it as anastomosis, or crossing over of the nerve from one side to the other side. Okay, Dr. John, lost of dimension because of contraction. Yes, that's a shrinkage has happened. Yes, doctor. Yes, Pakistan and Lego. Yes, doctor, I have already explained this question to Viva. Thank you for the amazing discussion. It's my pleasure, doctor. Dr. PD. That's okay. Dr. PD is good as well. Why not? BD, Bidu, Bida. Everything's okay. Thank you, Dr. Snail. Yes, Dr. Amna, I already answered this one right now, Dr. Amna. Scenario question 5, please check. What was wrong there? I think now this one is ended now. I cannot check it anymore. Okay, I will be checking later on, doctor, then. Dr. Bid, you are getting hungry now, yes? A little bit, Dr. Kadam. Not very much, but yeah, somehow. I'm going to get my dinner soon now. What's going on, guys, with scenario 1, question 5? Let me check this. How can I check it? Let me get my original file. You guys get this one. Let me guys get this one now. Check my mock on my laptop. Scenario 1, question 5. Scenario 1, question 5. What is the most appropriate study technique to extract 3-1? Okay. Okay, you mean, okay, guys, sorry. It's answer, guys, A, because, okay, I got your point. A, guys, it has epinephrine. Did I say E? Okay, guys, answer, guys, should be A, because this one has epinephrine. That one, okay, guys, the only difference, one plain, one was epinephrine. No, we use epinephrine, guys. We use epinephrine. There is no reason why I choose plain. I didn't get the, sorry guys, I didn't see the word plane. I thought like we're talking generally. Yes, so it's the same thing, Spaka lingual infiltration. Lignocaine, that's a gold standard. And then definitely we need the epinephrine, yeah. It's A, guys, okay, it's A. I thought E, it has the information, all the information. Sorry, guys. I didn't read the word plane for E. Okay, now, Yeah, I see Dr. Patton now. No, no, it was adrenaline. Should have adrenaline. Why not? It's a gold standard. Okay. Dr. Nekta, we have got the best mentors. Thank you very much, Dr. Nekta. We have got the best champions. I always say this. We are lucky in the academy for part one and part two to have the best champions ever. And these champions are successful and they are the leaders and they making this big community and they helping each others. Dr. Pamisa, thank you very much, Dr. B. Thank you very much, Dr. Pamisa, for spending your Saturday night helping us. Thank you very much. It's my pleasure, definitely. I'm very proud you are here and you're writing down the notes. Yeah, Dr. Sura, I got why. I didn't see the plane. The gold standard is lignocaine with adrenaline. That's a gold standard. No problem, guys. Thank you. Thank you very much, guys. Thank you for kind words. Thank you, Dr. Nandini. Thank you very much. Let me check, guys, if you have any more questions. We can answer it right now. And now, guys, shortly, once we finish from here, I will be actually posting for the mock exam. Thank you very much, Dr. Sneha. Thank you very much, Dr. Anshel. Thank you very much, Dr. Zoa. Thank you very much, Dr. Leas. Lies. Hopefully I pronounced it. I'm sure I'm not pronouncing the name in the correct way, but I'm trying. Thank you very much, Dr. Zoa. Thank you very much, Dr. Sayeda. Yeah, Dr. Amal, yes. Please mock okay, next week. I will post and then depends on how many of you guys can do the mock. Both of them is fine, Dr. Mima. Maybe no medical specialist. It should be oral medicine specialist or oral maxillofacial specialist, but not medical specialist. No. Thank you, Dr. Patel. Thank you, Doctor. Thank you very much. Thank you, guys. Thank you, Dr. Anam. Thank you, Dr. Mima. Thank you, guys. I think Dr. Shapina was A alpha, I think. Because you choose Dr. Lignocaine plain. Oh, no, no. It shouldn't be plain. It should be with adrenaline, definitely. Yes, Dr. John. Yes, yes, yes. I didn't say it's plain. I thought like with that's why I'm saying read all the options. Even I'm the one made the mock. If I don't read the options properly, definitely I will be confused between the options. Dr. Bidu, let's have two mocks every week, like two classes every week since comprehensive course begins. We have actually, for now, we have four classes every week now. Four? Yeah. Monday, like last week, I think we did four classes. Monday, Tuesday, Wednesday, Thursday was the mock. You cannot do class in the mock because you guys done the mock. Friday was yesterday. We did for part two. And today, 4 to 5 classes, four classes. I think that's enough. That's too much in you guys. I don't know if available more than this or not. I think Dr. Bidu Candice confused if we give infiltration. No, no, it wasn't plain, Dr. Ayushi. Yeah, I got it right now, Dr. Ayushi. It was about plain or guys, our gold standard is a lignocaine with adrenaline. That's a gold standard. Dr. Bidu, after Be Delicious, my new love is Bidopedia. But I tell you something, pedo is amazing. But you know, be delicious. It has its own. It has its own time. It has its own flavor. It has be delicious. I'm telling you, both of them very good. But for some reason, you know what? Both of them is very good. Yes, Dr. Tayas. Yes, you can go with oral maxillofacial surgeon. Yes. Dr. Nicholson, thank you for teaching us ADC language and way. It's my pleasure, Dr. Nicholson. And I'm very happy that you are here. I'm very happy that you find the things helpful to you, and definitely very happy that you learn new things. Please mock this week. Okay, I will be posting for it right now. Thank you very much, Dr. Andrea. Enjoy mock and enjoy the result even more. I'm very happy for you, Doctor. Yes, it was amazing. I'm very happy. Can we have mock every day, please? Every day? We have in Telegram and Facebook. We always have in Telegram and Facebook questions every time, so we can answer, especially on the page and the group. Okay, guys, thank you very much. Thank you, Dr. Bidu. You are very helpful with tips of Australian dental way of thinking. It's always my pleasure, Dr. Harvin. Thank you, guys. Thanks, Dr. Bido, for every minute you spend for us. It's my pleasure, Dr. John. And by the way, you guys always my motivation. The way you are here today, the way that you learn, the way that's motivating me to work harder for you. Please order food. Thank you for your session. Thank you, Dr. Kalam, for your nice, very nice feelings. Thank you very much. You are really nice human. Thank you very much. Okay, guys, thank you very much. I think I've answered all your questions. Thank you very much, you guys. Yep, I answer all the questions. There's no more questions left right now. I'm very happy. You know why? Because the questions, even question 5, even when I didn't answer even the with vasoconstrictor, you know the right answer straight away. That's fantastic. Thank you very much, you guys. Have a great night, everyone. Now it's crossing 2 hour session. I'm very happy. Thank you, guys. See you then, guys, on Monday. Thank you very much, guys, in the club. Thank you very much, you guys. Thank you. Have a great night, everyone. Thank you.